Hi there, and welcome to the Dawn Show. Dawn Stensland-Menti here. You know, autism and Asperger's syndrome are back in the headlines again because, as you probably heard, Susan Boyle, Britain's Got Talent contestant, who came to international attention when she appeared on the TV program, has just announced that she has been diagnosed with Asperger's syndrome. But can autism be cured? I'll ask that question to my guest, Dr. Robert Melillo, who is author of the book Autism, The Scientific Truth About Preventing, Diagnosing, Treating Autism Spectrum Disorders, and what parents can do now, and the host, of course, of the Dr. Rob Show, seen here on WMCN TV. Dr. Rob, welcome.
Well, thank you. Thank you. I'm excited to be here.
Well, as you know, this is a topic in my family because we have Karamia, my beautiful niece, right, who was diagnosed with autism many years ago. And so many families and many people are impacted. And there's Karamia at the recent Autism Walk, actually, with my son, Michael. And so we love Karamia. When she was born, they told Mike and Jeannie, she'll never say I love you. And so now, say, I love you, Karamia, I love you, you know. So you know this journey. I mean, you treat patients like this, and you know how much it touches people's hearts.
Absolutely. It's what I've devoted my life to, really. And we are, in the first chapter of the book there, I discuss how we are facing the largest childhood epidemic possibly in our history. There's a lot of controversy over whether the numbers going from 1 in 10,000 3 decades ago to now 1 in 50 children have autism. Those are huge numbers, and a lot of people automatically say, well, we're just recognizing it and diagnosing it more. And I show in the book there, and I really spent a year researching this, speaking to some of the top researchers in the world, that that's not the case. That at least 50% of that increase is represented by new cases that never existed before. So this is significant. We're seeing an increase that is dramatic. And it's not just autism, it's really ADHD even more so. ADHD is the leading childhood disorder in the world of any kind. #1 reason why a child will be medicated. 1 out of 9 children, 11% of the population in the United States, 1 out of 7 children will have some learning disability. So basically what we're looking at is 1 in 4 children this year will be diagnosed with some sort of developmental disability. And this is the issue.
Well, you know, Dr. Rob, one of the things I love about what you're doing is that you take away some of the mystery with autism, Asperger's, with ADHD, attention deficit, because there is all these titles. What do they mean? They really, when it comes down to it, don't they just mean a certain type of brain injury?
There's something wrong with the brain. In fact, it's not a brain injury, but it's a developmental issue in the brain, and so you bring up a very important point. And yes, you're right, that is one of the main things that I do in my books, and whenever I go out and speak to audiences, is to always try to start with the question, you know, what is actually happening in the brain of a child with ADHD or autism or dyslexia? And I ask that to, you know, the top audiences. I lecture all over the country, and I lecture to many different groups, physicians, therapists, PhDs, and I always ask that question, and no one can answer it. Most of the people that are working with these disorders have no idea what's actually happening, and that's been my area of research. I'm not only a clinician for 30 years, but I'm also a researcher. I've published many different research papers, and we just published actually in the top journal in autism on what is actually happening in the brain. And that's what's really critical, because there is this developmental imbalance where certain areas of the brain are immature relative to other areas, and this forms a communication breakdown so that areas in the brain aren't really talking to one another the way that they're supposed to. And this is called a functional disconnection, and this is the primary problem.
Well, and what I hear you saying, and this was why I wanted to show Karamia, because in other words, when she was born, her parents said, we're sorry, but she has autism. It's almost like saying the boogeyman. It's this big title, and what the heck is that?
It's very scary.
And so they then said, well, wait a minute, and they looked to people like you to say, well, you know what? We're going to work on this, and that's what I love about what you do, is that you provide answers and solutions and therapies for kids and give parents and families a lot of hope.
Right. Yeah, and I think that that's probably the main message that we want to give is hope, because once you understand what's happening in the brain and you understand that there isn't any true damage, there's not really genetic mutations the majority of the time. So you look at it and say, well, why can't we get them better? And there's been a lot of research, great research came out of the University of Connecticut over the past year showing that in a segment of the population at least, we know that 30% of even children with severe autism can be completely normalized. So the idea that these problems can't be corrected is wrong. We showed a paper this year in another major journal called the Frontiers Journal looking at our program at Brain Balance, which is basically similar to what we do, what I talk about in Disconnected Kids, but more sophisticated, where we had children with ADHD, and it was a control study, and basically what it showed was 81% of those children no longer had ADHD after 12 weeks in our program.
And this was without all the medications?
Without medication, right. I mean, we're learning centers. Brain Balance are learning centers. We're not healthcare facilities. We're not doing treatment, because there's another way to look at these as educational problems.
And you know what? I want to stop there. I want to talk about Brain Balance and really get into what that is.
Yes.
And why it's providing answers and so much hope and real solutions for families and kids. More with Dr. Rob when we come right back. And welcome back to The Dawn Show. My special guest, Dr. Robert Melillo, author of the book, Autism, The Scientific Truth About Preventing, Diagnosing, and Treating Autism Spectrum Disorder, and what parents can do now. And I should, this is such a great book, Dr. Rob, and I should mention you also are the author of Disconnected Kids and Reconnected Kids.
Correct.
So you've been doing this obviously a long time.
Yeah.
And we'll meet your wife Carolyn later in the show.
Right.
But the two of you have 3 kids. So
Yes.
you're a parent. You know what it is. Your kids are in college, but you know what it is to worry about
Absolutely.
kids.
That's really what drew me to this. It was one of the first children I worked with was an autistic child who wasn't speaking. His name was Daniel. Remember him. Have a letter from his mother. And I remember the parents came to see me and they had just been told that they needed to look for an institution, and they were crying. And they asked me if I could help their son. And I said, you know, I didn't know, because I didn't have a lot of experience working with children that were that severe. Started working with them in 3 weeks. The mother came in crying one day, and I said, uh-oh, what happened? And she told me that he started to speak spontaneously. And she had written a letter to Newsday, the local newspaper. She you know, had mass cards for me, and the other children were hugging me. And I thought to myself that if I did this, I don't know if I did this or is this just a coincidence, but if I did this, this is what I would spend the rest of my life, because they were the same age as me, her kids were the same age as my children, and the ability to relieve that amount of pain on parents was just unbelievable to me.
Well, what do you think about, in other words, you have the Jenny McCarthy's who come out and say, oh, this is absolutely the vaccines. And there's so much misinformation out there, controversy out there, that I think whether they're wrong, right, whatever, it just adds to that pain and does not add to solutions and answers.
Yeah, well, that's why, you know, my approach is unique and Brain Balance's approach is unique, because we're the first organization really to come out and say, this is what's actually happening. This is what the problem is. Nobody else is really dealing with the core problem. They're looking at different symptoms. So you can do some different nutrition issues, or you can look at something and say, well, it's an immune problem, or you can look at it and say that you know, there's all these other issues, and this is some of our children from our center here.
So Brain Balance, in other words, what is teaching kids balance or working with them physically? How does that reconnect their brain or help them with ADHD or Asperger's or autism? Well,
the problem is that there is a developmental imbalance that happens. The right brain and the left brain develop at different times. The right brain develops in the womb and for the first 2 to 3 years, then the left brain for the next 3 years, and then the right brain, left brain. So if something happens, some environmental factor slows down their brain development during a particular window, then that causes an imbalance, and especially if they're gifted in certain areas of the brain, as almost all these children are. So you take ADHD or autism, for instance. It's a right brain developmental delay. It really starts for the most part in the womb, and these children are exceptionally gifted in the left side of their brain. They're brilliant, and as their parents often are. And so what we see is this imbalance in developmental delay in the right brain means that certain areas, and it's different in each child, in their right brain are going to be immature. So that the right brain is the social, the attentional side of the brain, the social part of the brain, the part of the brain that controls nonverbal communication, that reads people's emotions, that has eye contact, that controls their gross motor movement, and that regulates their immune system in a certain way. So what we see is that by targeting the weaknesses, the areas of the brain on that right side that are weak, and we do exercises, physical exercises, mental exercises, we do academic training, as well as do diet and nutrition, we can stimulate those areas of the brain and bring that up to balance it out and match the other side. And when we do that, we're able to get them to form what we call functional connections, and now they can use the whole brain. And that effectively reverses the problem, because that is the problem.
So without drugs and all the medication, if parents can come to a brain balance center, they can actually work on this, and you have patients who then are, you can't tell the difference. They're no longer ADD, or is that?
Right. We have students because we're learning centers, but the fact is that, and so therefore we don't do anything medical or treatment-wise. And what we see is medications don't work. I mean, there's two major studies that came out this year. One, the largest study ever done on 14,000 children, called the MTA study, that had been going on for 10 years. And essentially it showed that medication worked for about 1.5 years at reducing symptoms. And then after that, there was no long-term benefit whatsoever. And in fact, the children that were medicated generally did worse. There was a study in Canada looking at 11 children, over 11 years, 4,000 children, and they looked at boys that were medicated and found that they did worse academically. So we know medication doesn't work on a long-term basis. There's no difference between children that were and weren't medicated. So it's not the answer. It may help reduce symptoms, but it's not the answer. And you know, so we are targeting the problem, and we're actually getting to the root cause.
Let's talk more about the answers with Dr. Rob when we come right back.
You come to speak.
Right.
I'm learning to understand my reading when I come here, because I read this chapter book and I actually understand it.
And the principal came up to me the second week of school to tell me how remarkable his maturity level had gotten just over that 2-month break. That she could not believe how much more mature he'd gotten. And I just said 2 words, brain balance.
It's pretty amazing. Welcome back. Dr. Robert Melillo is my guest, and we're getting some very good information about autism, learning disabilities like ADHD, attention deficit disorder. I have about 50 friends and relatives who are going to call me after the show and say, can you send me the YouTube link to this? Because if this, you know, this is one of those topics that we don't have enough on.
Right.
And I'm just thinking, why you should be everywhere. We want to yell, you know, shout this from a mountaintop, because there are literally tens of thousands of parents and family members who are saying, how come I didn't know this? How come you're the only one really targeting this? I know you're not the only one, but.
No, it's frustrating, to be honest with you, because I think that there is no more important social issue of our time.
This is an epidemic.
This is an epidemic, without a doubt. It's the largest epidemic we've ever seen. To give you an idea, polio was an epidemic at 1 in 2,700 children. We're looking at 1 in 4 that have some developmental disability. And why we're not screaming this from the rooftops. And it's frustrating, because the mainstream media, you know, all they want to talk about is weight loss and plastic surgery and, you know, and celebrity gossip. And, you know, it's unbelievable that these are the main issues. But when I go out into the street, or go to our centers or do lectures for parents, as I do, I mean, I'm inundated with questions. People are dying for real information and real answers. And that's what the book is all about. The first book, Disconnected Kids, was really about what's happening in the brain, and how the parent can actually do the assessment themselves at home, and how they can devise a home program that's like what we do at Brain Balance and get some great results and really understand what the issues are. Reconnected kids is as the child gets better, as their brain changes, their behavior changes, and sometimes it can be confusing. A child may go through their terrible twos when they're 6, but that's actually an advancement, but the parent doesn't always know it. So Reconnected Kids is about explaining that to them and giving them tools as to how to manage it, and also how to manage their own emotions, because many parents find themselves very depressed and very angry and even bitter. And so the book is about how to be able to reconnect to your goals and help and build your relationship. You know, 82% of relationships with autism end in divorce. So if we can help that, the Reconnected Kids is about that. And then the third book, Autism, is really about, it's the prequel. It's like the beginning of the Star Trek trilogy. It's what starts it all. It's how to prevent yourself from possibly having a child, not only prenatally, but preconception.
No, that's huge, and that's something we don't hear. So take me through that. In other words, what people can do so that they can prevent ever giving birth to an autistic child or ADD child.
And again, there's no guarantees, but what we can do is say, these are the known risk factors, and I've identified all of them in my book, that all of the really well-documented risk factors, things like, you know, pollution and smoking and exposure to pesticides, and things like, you know, if you have a folic acid deficiency. So taking prenatal vitamins 3 months before you're pregnant and for the first month of pregnancy lowers your risk of having a child with autism by 60%. If a woman has obesity, diabetes, or hypertension, any one of those three elevate her risk 60% each, 150% for other disabilities. So by doing things like looking at your body fat, monitoring your blood sugar level, monitoring your blood pressure, doing things like exercise before you're pregnant. See, what happens is that all of these factors, all of these environmental factors, what they're doing is they're turning off genes in a woman's body and in a man's body that build brain connections, so that when a woman and a man get together, we used to think that, you know, whatever they did would be wiped clean and the child started with a clean genetic slate. That's not true. Those things can be passed on, but what we're doing is turning the genes off. So what we need to do is, if they're off, when they have a baby, we need to turn our genes on. We need to turn our genes on, exactly. And so we need to do that preferably before we get pregnant.
So one more reason to be healthy and have good health. You know, it just amazes me, though, when you think about Obamacare, and we're talking about that, and so you look at the cost of 1 in 4 kids with autism, it just would make sense, would it not, to know all of this so that we're all healthier, and therefore, at the end of the day, we don't deal with all the cost of children with disabilities. I
mean, the cost is huge. We look at Autism Speaks came out with statistics showing that $126 billion was spent last year on autism alone. $5 million through the course of an autistic individual's lifetime. The average family spends $15,000 to $20,000 a year out of their pocket for a child with disability, and not to mention that our school systems are spending anywhere from $20,000 to $100,000 for a child in special ed.
So if there's somebody watching right now and they say, well, I don't know anybody with autism or any of these issues, guess what? This affects you because you're paying for it.
Exactly. Your taxes are paying for all these special ed services, and they're overwhelmed. And the schools are broke, and they can't afford it anymore. So the only way to really make a difference is to try to eliminate these problems, or to go directly to the family and give them the tools and the information so that they can handle it. Because our healthcare system and our educational system, this is the first time in history that both the highest problem in both education and healthcare has been the same thing, and this is developmental delays in children.
We want to talk about hope more with Dr. Rob and his beautiful wife Carolyn when we come right back. And welcome back to the Dawn Show, here with Dr. Rob Melillo. Now joining us, Carolyn Melillo, your wife, your better half, as they say. Yes. And you'll both be on the Dr. Rob Show here on WMCN TV. So welcome.
Thank you.
Thank you. And what a wonderful welcome edition. There is such a void for what you're doing. And I know for you, Carolyn, what you noticed about your husband's practice and all of his decades of research was that you felt like the moms in particular needed some empowerment. You're going to address that on the show?
Absolutely. I am, and I was a stay-at-home mother, and My husband traveled a lot. I know there are a lot of working mothers out there, and it's really difficult, and there isn't...
We're spinning those plates, Mama.
It is so hard, and especially if your kid has a disability, it's heart-wrenching, but it's also difficult. So I'm just here to sort of empower the women, to enhance them with new wardrobes, and also to show them fun, easy, inexpensive ways to do crafts with their kids, to interact with their children, and for the children to feel very good about themselves too.
So a lot of positives, but do you also give some advice? For example, I think of all the video games that kids watch nowadays. I would imagine with autistic kids or ADHD kids, video games, what do you say about that?
You know, we have, you know, very strong opinions on that we're not going to be shy about. That, you know, I believe that the single biggest factor that's causing this is the lack of exercise, the lack of physical movement, and all of the things that come from that, obesity, diabetes, and these developmental delays are exactly the same result of that. So the way it affects adults, these you know, epidemic rises is what we see in our children. So things like video games, you know, we didn't have video games in our home with our kids, and we would make them go outside, and we're pretty old-fashioned type of families and parents, and we believe in that, and that's what we're going to talk a lot about, because that really is critical for brain development.
What does it do for your marriage to be starting this show? I mean, you've raised your 3 children, they're in college. What does this do for the 2 of you?
It definitely helps. Seeing my husband on a regular basis is fantastic. But it's also, it's nice to be able to share, you know, everybody has problems. Certainly we did too. Our kids have gone through things. That's normal. I think that we can share the fact that you can get through these things. As a unit, as a family, it's really important to be connected with your children. And it's hard, but through Rob and through all of his practices at Brain Balance, I think he is connecting families back together, because they have answers now how to deal with their children, what they can do for their children. It's not going to be a mystery anymore.
Well, Carolyn and Dr. Rob, I think this is going to be huge. You're starting a revolution here on WMCN TV. I'm so excited to be a little part of it and to welcome you here.
Thank
This
you.
is wonderful.
Thank you.
And this is hope for so many of you.